welcome. Oh, well, thank you. Thank you. I appreciate that introduction. And glad to be here with you today.
Yeah, so the reason why I wanted to talk to you today is because you're so specialized, and I wanted to get your thoughts about some of these areas with COVID-19 as it pertains to children of color and also people who are socioeconomically disadvantaged in our society. And just thinking about those populations. So have you seen any patients with COVID-19?
Yes, I have seen patients with COVID-19. They have had pretty mild symptoms compared with talking with my colleagues who work with the adult population. Most of it is the cough, the fever, and it's not been an extremely high fever. It's been a low grade, 101, 100 fever, but it's the dry cough, fatigue, some chest discomfort has been some of the symptoms that I've seen. Some GI symptoms, they say that they've been nauseous and have vomited, but it's not an extreme amount of nausea and vomiting or loose stools. But those have been the main symptoms. Sorry, I'll turn my phone off.
That's okay. So have you seen any kids with lung problems, asthma, or situations where we would worry about them getting into trouble with the lung aspects, like with the ARDS types sequelae?
So that's a hard question to discern, or hard problem to discern in the emergency room when you're in the immediate vicinity of taking care of a patient, because they may have underlying asthma. So it's also spring, so allergies are starting up, and some kids, just are, and this is, since we did not have a cold winter, the spring has started sooner. So they are coming in with wheezing and coughing and sneezing, and many viral illnesses follow the same path. So we have been doing, if they have a fever, we do flu tests, we do respiratory syncytial virus testing, maybe a viral panel on them. And if they need admission, then they get COVID, all of those kids get COVID testing. Unfortunately, we don't have, at our hospital, currently, we don't have any of the rapid turnaround tests. So that's still going to take several days for the results, but they're isolating those patients from patients that, they know, don't have COVID.
Do you all have one of those triage tents at your hospital?
Yes, but the triage tent that they have is not run by our hospital. It's run by a separate group, and so we're not staffing that.
Oh, okay. So do people come directly into the ER, or do they go through that tent first?
No, they come directly. The kids come directly into the ER.
The ER.
The
okay.
Pediatric population comes directly into the ER.
Okay.
Whether it's good or bad, but the pediatric population in the emergency room has diminished, because I think kids are staying home. They're not grouped together with their athletic sports, their play groups, babysitting or daycare settings. They're at home with a stable group of usually family members. So they're not catching as many viruses. So our population of sick patients has gone down about 40%.
Wow.
And also, I think because they're not outside and outdoors playing in the parks and games, and, soccer, baseball, basketball, whatever, they're not getting injured as frequently, so the pediatric population, not the adult emergency side, but the pediatric population has diminished as far as ER visits.
Mm-hmm.
Mhm.
And I wanted to ask you, you kind of are going into the next question that I wanted to ask is, what would you advise your patients and their parents to do to prevent getting the virus?
Mhm. Absolutely what you've heard many of the experts say, social distancing. So I know the kids may be restless and bored, as they say. We're bored, you know. And you don't want them to watch TV all day or video games. But no play groups, no, you know, meetings with other kids, because unfortunately you're not sure, you know, what their exposure has been. And it may, most kids are going to do fine. The number of the severity of most kids with no comorbidities is pretty low,
Mm-hmm.
but you don't know who else you're going to come in contact with. Maybe you have somebody in the family has comorbidities and then you expose them, you know. So if you have a father, an uncle, or a grandparent at home who, you know, has been a cancer victim or has, you know, hypertension, diabetes, you know, the other comorbidities that unfortunately we may see in our community, they will then be affected or could be affected drastically by the child bringing it home, or, you know, if they are going to play groups, or, you know, what you think might be an innocent meeting, it might not be so innocent, you know. So if they do, you know, encounter friends, if they're out in the yard or playing, make sure that, you know, they wash their hands really well when they come in, and not just their hands with soap and water, but up their arms, you know, take off their clothes, put them in the, you know, the wash, so that you don't expose everybody in the home, you know, because, you know, I see the kids on my block and they're riding their bike, but, you know, they may come in contact with the other kids that are out playing too. So, you know, it's hard to contain children, you know, 24/7 when it's a beautiful day like today. But you could do, you know, family things together, maybe go for a family walk so that you can, you know, keep, you know, the child occupied doing something that is, you know, energetic, to get rid of all of their excess energy. Um, but you don't really want to let them just have, you know, free reign of the environment around them, so that they won't come in contact with other kids that may or may not have been exposed.
Yeah, I've seen some families out and about here with small children, and I try to stay back because I notice the small children are having a difficult time understanding, you know, to stay away from other people.
Mm-hmm.
Yeah, so what would you recommend for that age group, for the parents of that age group when they're going out and about? And then what also would you recommend for people that have teenagers? Because teenagers, I see them roaming around the town,
Mm-hmm.
and they're not with parents, and you know, it's during the daytime and that's okay. But I also noticed that some of them are not as cognitive about the social distancing.
Um, I think it has to come from the top, meaning, you know, whoever's in the home, you know, whoever the guardian is, or the person that's the, you know, authority figure, mom, dad, you know, grandparent, whoever is with them. You know, you just have to restrict their wandering. You know, if there's a teenager, you know, they just can't, you know, be all over the neighborhood. I saw kids playing basketball, you know, when I was on my walk today. Now the rest of the trail was pretty, uh, there
Empty.
was nobody on the trail,
Mhm.
but the basketball court, and I don't know if they were all related, but there was, you know, 4 people on there, and I don't know if those kids were related. But, you know, if the basketball court was deserted, then, you know, you and maybe your brother or sister could play on the basketball court. But if there's somebody else coming, you know, and a adult should supervise that. So if somebody else wants to use the court, you know, to take heed to the 6 feet of distancing. Either you have to leave the court, or, they play on one end and you play on the other, So at this point, it's very important that they, follow the directives of the healthcare workers until we feel that we're out of the woods for this pandemic. I would carry hand sanitizer with me, if I'm out with my kids and you think that they have, touched another person. So at least, you might have that layer of protection, so that you can put the hand sanitizer on their hands. You can't have soap and water, because that's the best way to help with controlling what you've touched. But since you don't have soap and water when you're, at the park or the grocery store, certainly carry hand sanitizer with you. I certainly wouldn't take children with me when I'm doing shopping spree, trying to shop for the family, because so far it's been a little over 2 weeks, and for the most part, you're going to need to go to the grocery store. But I wouldn't make that a family outing. I would, get your list together, go by yourself, or let just the adults who can, control, what they're touching, and, decide, without kids, running around and getting in the cart and out the cart, if they're little children. But, so certainly, but you do want them to release that excess energy. So if you have backyard, if you have any type of basketball court in your yard. My neighbor across the street has a basketball hoop, and he's out there just, shooting hoops by himself. And I've seen the other kids down the street playing in their yard together, the 3 kids that live down the street. So you just have to contain them in your yard, and be vigilant with watching your children. Many times, before, the parents will let them play outside alone, but you don't want them running around the neighborhood to, come in contact with other people and other children who may or may not be positive,
Yeah,
So,
I've seen kids, I've seen parents doing a good job letting kids run down a sidewalk to a certain, like running around their houses, or riding a bike to a certain distance where they can see them. Yeah.
And
So
we're lucky here. We have a big park service. We have a big, integration of different parks and paths and stuff like that. So since there's a lot of family time, it seems like a lot of adults are home. This is a time to try and take them to a park that is, sparsely populated. Don't take them down to the cherry blossoms, which they had to finally block off the roads down there, where, people are interested in that national treasure. But park I've been walking through has been maybe 2-3 people at a time that I have seen on a hour-and-a-half walk. I have not seen many people. And so the field there was nobody on the field. So you could take your toddler, you could take your 5-year-old and maybe play ball and, let them run around and, release some of that, tension and energy. The tennis court, was empty. The basketball court did have one day. It had, 4 kids, and I don't know if they were a family. I didn't stop and ask, but, there was some kids on the basketball court. So hopefully they were all related, So, and pick a time that's convenient for you and your family. And then you can get some exercise too, because you can walk around the field maybe while they're running, or you can play ball with them, so that you get some quality time with your kids, as well as you can get maybe some exercise too.
And what can people do what are basic things that people can do to help boost their child's immunity? Because I feel like with adults, this is where, people have been clamoring to get the toilet paper and clamoring for the hand sanitizer. But what can children and what can their parents help them do to boost their immunity?
I think one of the best things that you can do to boost their immunity is, love and affection, for one, just knowing, that now is a good time to show them that, because I think, that positive reinforcement of a parent being around, but also really healthy eating. When I did go to the grocery store, the brown stuff was gone, meaning bread, crackers, snacks. And because I'm a
Baked,
vegetarian,
baked goods.
I went straight to the vegetables. I was able to buy spinach, squash, or zucchini, carrots, and then I tried to buy a variety of things. I bought things that would perish quickly, like the spinach and the squash will go. But then I bought cabbage and Brussels sprouts, which I know could last me to the end of the week and wouldn't spoil immediately. I could cook them later in the week. So, try and think about, the things that you buy that are healthy. So yes, I'm going to have to eat the spinach and the salad making a little sooner than I have to eat the cabbage and the sweet potato, so also make your shopping list like that. I'll try and stick with simple, healthy foods, try and stay away from, too much pastas and potatoes, but go for sweet potatoes and brown rice and quinoa and more healthy things. And you can go online and look up many, healthy recipes that, and you can always try and mince the vegetables if you have kids that don't like veggies. Mince those vegetables in there really well. You can buy pasta that's made from beans so that, kids are getting some protein, with that. And you can put the red sauce on that and then chop fresh tomatoes and chop fresh veggies in there, so small that they can't even tell that they're in there, if you have a child that is vegetable adverse. So I think, good nutrition is another thing. Exercise, whether it's just in your backyard, taking family walks together, limiting too much screen time. I think, certainly, I looked at the cherry blossoms online. They have a web camera. You can look at different zoos.
Right.
That can, you can look at, for the time, I would make it a little more educational. Try and have them do things that might be, fun or educational. But there's a lot of web cams that are either at zoos or parks or, showing nature, so that they can look at that during the screen time. But I wouldn't let them watch TV or be on the computer playing video games. And good sleep, make sure that they're getting good sleep, because that's very important for their growth and development, is that they have good sleep. I know it's a time where everybody's off, but they should still follow some type of schedule so that they're not exhausted. And if their bedtime normally is 8, maybe give them an extra 30 minutes, but I would not let them stay up till midnight running around and playing. So
Mm-hmm. How do your patients do with hydration? Because in adults, I think that the reason why it's spreading so quickly, the COVID, is because most adults are dehydrated and don't drink enough water.
Mm-hmm. Well, I always try and tell parents, if they ask me anything about nutrition. Unfortunately, I'm in an emergency room where that's usually not part of our discharge instructions, or we don't spend that kind of quality time. But if they come in with issues with especially constipation, then I start helping them with small amount of information that I have in the time that I have, talking to them about nutrition. One of the big things I talk about is hydration. After they have gotten off their formula, they really don't need a lot of juice. They should be eating the fruit. They should be drinking more water.
Love that.
Yeah. So, I always say, don't drink your calories, and that's more so, for myself, I always say that, but also they're getting the fiber, they're getting the nutritional value of eating the strawberry, the raspberry, the apple, rather than drinking a lot of apple juice or those combination juices that you see in the grocery store. So I always tell parents to, try and instill the love of water in them. They can flavor the water by maybe cutting up the different fruit, cutting up strawberries or cutting up cucumbers. That gives a nice flavor to the water so that they're not adding extra calories that they don't need. But, if they want something, they should eat a luscious strawberry or raspberry or, blackberry, so that mango, and introduce your kids to a variety of different fruits and vegetables so that they get good nutrition. I think that is one of the main ways that they'll stay healthy, even through this and other infections that they come in contact with. Mm-hmm.
That's a good segue to my next question, which is if their kids get sick, what can they do at home? Mm-hmm. And I realize this is probably a long question, but when should they bring their kid to the emergency room if they have some of the symptoms of COVID?
Mm-hmm. So if they have a cough and fever and they're still energetic, certainly their appetite and their intake may decrease, but if they're still pretty energetic and they're not listless, they're not laying around like a wet noodle, those kids can do fine at home. Yes, you don't have to know every child that has COVID. Many of the cold viruses are coronavirus. And so there's the serious coronaviruses, like when we had MERS or SARS. Those are the more serious, more virulent ones. And so is this one. This is a SARS virus 2 that they have now named a SARS-CoV-2. So it is a strain of coronavirus that's pretty virulent, but cold viruses are a milder form. So kids do well with coronavirus so far in the past. And so far with this illness, the kids that are out of the newborn range have been usually doing pretty well, unless they have any comorbidities underneath. If they have an immune deficiency, a congenital cardiac issue, those kids will need to be seen by their specialist or the emergency room. Now, if your child looks like they're short of breath, they're having trouble breathing, they seem extremely sleepy, they're dehydrated, or any other signs or symptoms that you are concerned about, certainly you can either call your pediatrician, because many pediatricians now, because of this pandemic, are doing telemedicine through their office. So, if you have a pediatrician, that may be the first place to start, is to talk to them. If you cannot reach your pediatrician, then any emergency room would be happy to evaluate your child. As I said earlier, the pediatric population has not been overwhelming the emergency room like the adult population. So far, we have not seen those numbers. Those numbers have gone down as far as the patient population. So you should be able to get in and out of there, more quickly than at times when we would see, like a flu epidemic, because flu would affect kids and adults, and we're not staying home so much, with the flu.
Mm-hmm. Mm-hmm. Okay. Mm-hmm. And where in your work environment, how are you and your colleagues feeling about the supplies of the equipment, the personal protective equipment?
So far at Shady Grove, we have been trying to be pretty diligent about not overusing, or we're reusing the masks, just the simple surgical masks. We will reuse that one. Now, if I have a kid with a serious respiratory issue, then I will change the mask. And if we feel that there is possibility that the child is COVID positive, then we're so if they're doing a lot of coughing, they've got high fevers, then we're putting on the protective gear. We will try and reuse that N95 mask by putting the N95 mask on, which we've been fit tested for to make sure it fits us well. And then we put a surgical mask over it to try and preserve, now if it's physically or, visibly soiled, then we would throw it out. Or we know we got in for somehow it got contaminated, then we would throw out that N95 mask, but otherwise we're reusing it. And how we're trying to protect it is by putting a surgical mask on top of it. We, use gloves and a gown, plastic sterile gown for those children that we suspect have COVID. And so far, we've been doing pretty well. We usually test the children first for RSV and flu, which now we have a test that's a combined test for that at our hospital, so that when we get that back, if we feel it's COVID or if they need admission, then they will get tested for COVID.
Okay. And what are you doing to keep yourself safe and healthy? Because I know you're one of the people that I know that eats very healthy and has a lot of healthy habits. So maybe you can share.
So my healthy habits have been social distancing, and I've been on the phone, either FaceTiming friends, so that, if just to check up on them and see how they're doing. So just since I have one other person living at home with me, that's good, because now I have, another person to interact with. And the two of us have been, she's my cousin, so we have been social distancing and just the two of us doing things together, like we take walks together and, have conversations together. I have, on the rainy days, I have a gym downstairs. I've been exercising. I have an elliptical and a bike I've been doing routinely. And then I've been getting online and I've been doing some yoga. So you can look on YouTube, and there are probably other sites that have exercise programs that are even fun for kids. So they have lots of, go to YouTube and look up, exercise programs families can do together. They have, jazz dancing and, fun things that kids do. I have personally been doing the yoga classes, and then I did, a bar class. I did a kettlebell class. You can do a 10-minute one, you can do a 30-minute one. So I've been doing like 30-minute yoga classes. And then yesterday I did a stretching class after I rode my, after I was on my elliptical, because it was raining here yesterday. So I did my elliptical for an hour, and then I did a stretching class and a 10-minute bar class.
Cool.
And then I've been trying to make sure that I go to sleep and get good sleep. And I've been putting on some meditative music before or during the time I'm sleeping, and try and, just clear my thoughts and, pray right before I go to sleep or I fall asleep.
And I know you eat really healthy, so maybe you can just tell them how you eat, how you normally eat.
Well, I've adopted a plant-based diet over 30 years ago. So when I eat, I usually will try and look at filling my plate with lots of green vegetables. And, so I've been doing a lot of spinach and salads, but I also want to make sure I get good protein too. So I made pasta the other day, but it was made from chickpeas. And then I made a stir fry, and I added kidney beans to that. So I try and make sure that it's balanced. I unfortunately have a little bit of a sweet tooth, but I try and limit that. And then I have a nutritionally dense bread that my friend, Dr. Satcher, helped me make. And it is yummy. It's made with pumpkin seeds and sunflower seeds and flax seeds and chia seeds. So it is delicious. I was like really surprised that all that was going to come together in a bread, but then I've been experimenting since she showed me the basic formula, since you showed me the basic formula, and I put raisins and cranberries and cinnamon in it, and that one is delicious. Even has my 91-year-old mother loving that. So
Oh, cool. I'm glad she likes it.
yeah,
Wow.
you
Yeah, I've
know,
done the raisins. The raisins are and the cinnamon are good.
yeah, that's delicious. I tried another one, another form of it, but so you can. Oh, that's another thing to do with kids. Find recipes online that are healthy, and maybe
Mhm.
have them, if they're old enough,
Prepare it.
help prepare it, so that,
Mhm.
again, another family joint project to do together. What do they want to eat tonight? Okay. And
Mhm.
so maybe make a lasagna together, and then try and find one that may have a healthy additives, like lots of vegetables in there, as well as if you eat meat, then try and buy meat that's the cleanest as possible, grass-fed meat, as opposed to
Mhm.
some of the other meats. But
Mhm. Mhm.
so I think that's one of the best ways to stay healthy, as well as keeping your family close, doing projects together, good hand washing, especially if you've been out and about, do running the errands. Sometimes we have to go to the post office. Sometimes we have to go to the grocery store. Before you come back through that door, make sure you, as the authority figure, or the mom or the dad, wash up really well. Some of us are in um, you know first line jobs where we have to go to work. So you just want to do the best you can to protect your family when you come back in that door. I would change my clothes immediately, so that you're not bringing unwanted virus, into the home.
Mhm. Yeah, so, and that's a good segue into, do you have any concerns specifically for people of color, or, um, you know, people that are on the lower socioeconomic spectrum?
Mhm.
Because I was just thinking about when you were talking about people are still having to go out to work. Um, Many people, they've got to find work, or maybe they lost their job. What kind of recommendations can we give them?
Mhm. Um, I think one of the best things is, try and keep an open mind, try and be positive, because this too will pass. It may be obviously longer than anything else this is horrific and horrendous, but this too shall pass. Make sure that, you talk to your loved ones, even if they are not in your immediate home, if you know that they may be able to help you out, if you are feeling a financial crunch. So mentally, I think that would be one of the biggest concerns of many. Can I pay my rent? Can I pay my utilities so I can keep this roof over my head? But some of the um, laws, at least in Maryland, is that you cannot put a person out during this. You can't be evicted during this. So you have to look at your state laws. But our governor, um, is saying that people can't be evicted during this pandemic. And so, you have to look at your state laws and find out, what is being put in place to help protect you, because this is unprecedented. Nobody expected this. And many people, because it's been mandated to stay home unless you are on the front line. So you're not bringing in the income. I think keeping a positive attitude, you know, uh, working to find out what, is available as far as relief, help.
Like
There are,
resources?
yeah,
Mhm.
resources. There are food banks, that are available and they're being mobilized. So, all of those are ways to try and um, make sure that your family has enough to eat, has a roof over their head, and meditation and prayer, also will help you have a good state of mind too. Mhm.
Mhm. Yeah, I'd add to that, probably some churches are trying to provide some resources for people, and
Mhm.
um, and definitely the food banks, and also just like uh, I was telling somebody the other day, like a basic food combination is rice and beans that can be
That's
acquired
protein.
very, very cheaply.
Yeah,
Um,
total
like, I mean, you
protein.
could get a bag of rice and a bag of beans for under $5 that will feed you
Right.
for a week. So,
Mm-hmm.
mhm.
Yeah,
So,
that is a good, yeah.
mhm,
That is a good message right there, because rice and beans are very healthy for you. Hmm.
mhm, mhm. Did you have anything you wanted to add? I thank you so much for
Hmm.
doing this.
Yeah,
It's
it
going
was
to help
just
a lot of
wonderful.
people.
Yeah, it was just wonderful being with you, and everybody stay safe, wash their hands, social distance, and if you're in the same home, show some love to each other. Mhm.
Mhm. Okay, I'm gonna see.